We're going to start our press conference in a couple of minutes. Thank you, everyone.
Thank you for shade.
Yes.
It's great to be an extra with you.
Give me 1 minute.
Too short to be in the back row there. 13.
On one side of the mirror.
Oh, there's Lisa. Okay.
Oh, Lisa Ward? Come on up. Lisa, come right here.
I'm so glad we're getting this level of attention.
Yeah, Alex. Come by me, please.
Alex has great hair. You see that?
Hi, dear.
Folks back here, the mic is hot.
It's hot. Yeah.
Media's got a hold of it.
So they heard that Alex has great hair. He has great
You
hair.
could say that. That's good.
Yeah.
That's good. How are you, Friday? Good to see you, man. That's everything.
You took my phone.
Thank God. Thank God.
Where's Manny? Manny.
Okay, we're going to give start. Just say the run of show. Thank you, everyone. We're going to start our press conference. Thank you, everyone, for being here. We're going to start with Miami-Dade County Mayor Daniella Levine Cava. We're going to be followed by County Vice Chair Oliver Gilbert, and then County Commissioner Eileen Higgins. After that, we're going to hear by Mayor Dan Gilbert, if he has arrived, from City of Miami Beach, our interim Chief Medical Officer, Dr. Lilian Abo. After that, Orlando Gonzalez, the Chair of Miami-Dade County's LGBTQ Advisory Board and also Executive Director of SAVE LGBT. And finally, we're going to hear from Martha Baker, Executive Director from SEIU Local 1991.
And then we'll do the Haitian Creole, and then we'll take
And we're going to do, after the mayor speaks, she's going to speak in English and in Spanish, and we're going to do Creole interpretation, and we're going to continue with the rest of speakers. Mayor.
Good afternoon, everyone. Thank you so much for being here. Very, very important announcement today. I'm proud to be your mayor, Daniella Levine Cava, and I want to say that we want to update all of our residents on our community efforts that are now underway to curb the spread of monkeypox and to distribute the monkeypox vaccine in our county. An extra special thank you to each of the elected and community leaders who are here with us this morning. Everyone is working of our Director of Emergency Management, Orlando Gonzalez, Stratton Politzer from, Orlando from SAVE, and Stratton Politzer from Equality Florida, and our co-chair, Miami-Dade County's LGBTQ Advisory Board and Executive Director of SAVE. Let me start again. You all know who's here. They're good. Okay, all right, we're good. And we're all here. And
we're with you.
Okay, and Ron Gonzalez, our partner with Nomi Health. So as our community is facing this new and growing public threat of monkeypox, we are stepping up once again to deliver a coordinated response. So as county mayor, my top priority has been to bring leaders at all levels together to one table to facilitate the coordination and the communication across our entire community. And the good news is that we face this virus having gone through the global COVID pandemic, and we have emerged stronger than ever. COVID-19 taught us many things, and it taught us that we must act as a community to protect ourselves and each other. So we're taking advantage of the many lessons learned, the robust infrastructure that we still have in place, that we have never stopped serving the public to offer services to those in need of protection from monkeypox. In fact, it is our comprehensive public health infrastructure, including the vaccine and testing sites, that we continue to operate countywide in close collaboration with our partners at Nomi Health, that makes us here in Miami-Dade County uniquely positioned to help distribute these new vaccines for monkeypox. And I feel confident that we're ready to swiftly respond to this new threat. So we now have recorded 404 cases of monkeypox in our community, and to protect our residents this week, we're launching our first 2 monkeypox vaccination sites here in Miami Beach and in Tropical Park in partnership with Nomi Health. And supply is very limited. We have received 1,000 vials, and under federal government's new guidance, which we just got yesterday, this will now provide up to 5,000 individual doses. So 1,000 becomes 5,000. And we are booking vaccination appointments already. You can check online at miamidade.gov/monkeypox, or there's a call-in number 1-833-875-0090. So we're working aggressively to bring more vaccines as quickly as possible. So we want to meet the growing demand in our community and to protect all of our residents. And just last week, I sent a letter to the State Department of Health asking for additional doses of the vaccine and increased public education to inform our community. So we stand ready to distribute all the vaccines that we can get, and as quickly as possible as we receive these additional doses to get them out. And we will open additional sites as well to more parts of the county as supply increases. In addition to the vaccinations, we're working to provide the full spectrum of care for monkeypox at those sites, and that also includes testing and eventually treatment as supplies are available and new treatments are approved for use. Supplies are extremely limited, however, as we've said. They are available for those in the greatest need, at the greatest risk of contracting the virus. So you can learn more about who that would be, who would be eligible, from our medical officer, our interim chief medical officer, Dr. Lillian Abu. She's going to speak shortly about that and provide more details. Just for everyone to be aware, the vaccine is administered in 2 doses. After the first dose, you will be contacted to come back for the second dose after 4 weeks. So protecting yourself and the community is essential, and we urge everyone to take the proper precautions that have been outlined by the CDC. That is, avoid close skin-to-skin contact with people who have a rash that looks like monkeypox. Avoid contact with objects and materials that a person with monkeypox has used. And finally, as always, wash your hands often. So it's real, it's serious, and it's here. And we are ready to respond and to protect our community. And I especially want to take a moment again to thank our frontline workers who are once again being called on to respond. You are the reason that our community has made it through the COVID pandemic, and we will continue to emerge stronger than ever. And it is through your extraordinary dedication, your sacrifice, that we can continue to protect all of our residents. So you are valued, you are cared for, and I thank you from the bottom of my heart. So thank you to the community leaders again who've come here to play a support role, and to all the members of the media who are carrying this critical story, communicating about it. And I am fully committed to ensuring that our community gets the vaccine that it needs and gets it into people's arms as quickly as possible. Estamos aquí hoy para informar a los residentes sobre nuestros esfuerzos para frenar la propagación de la viruela del mono. En este momento, Miami-Dade tiene ya 404 casos confirmados. El condado de Miami-Dade se está preparando una vez más para proteger a nuestra comunidad. Vamos a aprovechar las lecciones que nos dejó el COVID-19 y la infraestructura que aún tenemos para ofrecer la vacuna contra la viruela de mono a quienes más la necesitan. Esta semana vamos a abrir nuestros primeros 2 sitios de vacunación aquí en Miami Beach y en Tropical Park, en asociación con Nomi Health. La oferta es limitada en este momento. El condado de Miami-Dade ha recibido 1,000 dosis de la vacuna y la daremos a nuestros residentes cuando llegan más. Estamos pidiendo más del Departamento de Salud del Estado, y cuando lleguen vamos a usar inmediato. Para pedir una cita, vayan a miamidade.gov/monkeypox o llaman a 1-833-875-0900. Recuerden que esta vacuna es de 2 dosis. 4 semanas después de recibir la primera dosis, Les llamaremos para programar una cita para la segunda dosis. Muchas gracias. And now in Haitian Creole.
Bonjour tout le monde. Jeudi, nous réunis pour nous capables de une mise à jour sur l'activité que nous allons entreprendre, tout effort que nous allons faire pour nous capables de combattre le variole singe là qui commence à imposer. Pour le moment, nous avons enregistré 400 cas dans la communauté noire. Et pour protéger la communauté, nous avons fait tout ça nous capables pour nous établir des sites de vaccination ensemble avec partenaires nous qui c'est Nomi Health. Et dans ce site, ça, nous sommes capables de commencer à protection avec les gens qui ont besoin de protection. La communauté noire prend un pile choc avec COVID-19 et nous prenons ça comme expérience que nous avons gagnée pour nous mettre à disposition publique là valeurs robustes et infrastructures robustes que nous avons gagnées pendant la période COVID-19 là. Contre Miami-Dade, tu recevoir 1000 jeux vaccins et avec guide fédéral que nous avons gagné, nous sommes capables de servir 5000 cas individuels avec quantité que nous recevons. Ça veut dire que nous gagnons une quantité qui est vraiment faible et par le fait que nous avons une quantité limitée, nous avons priorité avec les gens qui gagnent cas qui sont plus exigeants, les gens qui sont plus à risque. Pour capable joindre les gens qui sont plus à risque, qui qualité moun yo, ou pour aller dans le site nous qui c'est site internet miamidade.gov/monkeypox et ou capable tout faire tout ce capable pour entrer sur le site noir pour enregistrer pour capable aller prendre vaccin. C'est même site là miamidade.gov/monkeypox. Numéro de téléphone pour aller c'est 833 875 0900. Merci.
So, okay, Vice Chair.
Good afternoon, everyone. I won't be long, but the mayor said something that was very important, and thank you for doing this, Mayor. Thank you, Commissioner Higgins, Mayor Gilbert. It's always good to see you. And the frontline workers, thank you all. We've learned a lot of lessons from COVID-19. And why I thought it was so important that I be here and that we stand here together today is because one of the lessons we learned is that what affects Miami Beach affects Miami Gardens. What affects District 5 affects Districts 1 and 13. We are actually one community. And COVID-19 showed us that. It showed us that we could never divorce ourselves from each other, that what affected one person was going to affect all of us. And if we aren't vigilant in washing our hands and sanitizing and if you feel like you're infected, getting tested, getting treated, if we aren't vigilant in these things, this becomes something more than it has to be. So we've been here before, and we are absolutely smarter now. We are more in tune with the fact that we are really one Miami-Dade County. We're really one South Florida region. And that when we act together intentionally and purposefully, we can actually make everyone safer. That's what we ought to do right now. When you hear the mayor speak, when you hear Commissioner Higgins speak, when you hear everyone behind me speak, you need to remember that we were here before and people didn't take us seriously before. We were here before and people did not take us seriously before. Let's not be that group of people again. You only have to teach us a lesson once. We've learned, we're smarter, and we're going to do better. I appreciate everyone. Thank you all very much.
All right, that's good. Thank you.
Good afternoon, everyone. Commissioner Eileen Higgins. We are in District 5 today announcing the start of appointments for anyone in a high-risk population that would like to make an appointment to get vaccinated against monkeypox. As you're all aware, the supply is limited, but send us an appointment. We'll make sure you're on the list. It is just like everything we've learned during COVID. We may have limited supply this week, but it's going to get better and better and better. Get an appointment, get vaccinated. The reason we're here in Miami Beach and why it's so important to be in Miami Beach, we have a large concentration of vulnerable residents and high-risk residents that live in District 5. And so I wanted to make sure, and the mayor wanted to make sure that it was convenient as possible and as easy to possibly to get vaccinated. This site is well known. It's near the library. It's accessible via public transportation, and we'll be opening on Friday for the first vaccinations. Please be careful, everyone. You can protect yourself from monkeypox. Follow the instructions on the website. Make an appointment to get vaccinated, and we will make sure to stop the spread of monkeypox in our county. Thank you very much.
Yeah, okay. I'm Dan Gelber. It's my privilege to be the mayor of this city. You know, as Chairman Gilbert pointed out, one of the most critical things is to get on the same page. We know what happens when we're not on the same page. We know what happens when people politicize a response. So I want to thank Mayor Levine Cava. I want to thank our county friends who are here. I want to thank my colleague, Commissioner Fernandez, who has been talking about this from early on. And I especially want to thank all of the healthcare professionals and the private organizations. Because the one thing we know is that if we're not on the same page, then people make mistakes, people think they don't know what to do, and bad things follow. And the job for us today is to let all of our communities know, and my community know, that there are things you can do, there are things to look out for, and we all agree that you should be doing that. There is no dispute here as to what we should do. We're not going to let this be politicized. We're not going to let misinformation come out. We are going to have one voice with one direction, and that is why we are all here today, shoulder to shoulder, to say, listen up, be careful, arm yourself with knowledge, and if necessary, give us your arms for a vaccine. All right, because at the end of the day, knowledge and information is what protects you most during a healthcare challenge, which we are in right now. So thank you, Commissioner. Thank you, Commissioners. Thank you, Mayor. And thank you especially to all our first responders and all those in healthcare who are stepping up to really make sure our community is prepared and ready for this challenge.
Great, thank you. Mayor, who's next?
Okay. Hello, my name is Orlando Gonzalez. I'm the Executive Director of SAVE, Safeguarding American Values for Everyone. I'm also the Vice Chair of the LGBTQ Advisory Board for Miami-Dade County. I am a gay man, and I just want to be very explicit to express my sense of relief that we now have vaccines here. One of the things that we know for sure is that our community was impacted first, but this is not a gay condition. It's a condition that impacts everyone. And so there was some politicization of this at the very beginning. However, our county and our leaders here have been very responsive in acknowledging that and making sure that they cut through all of that and are very responsive in being able to provide a response to the community here locally. So again, huge sense of relief. Our community is often afraid whenever anything like this happens because we have the memory of what happened with HIV/AIDS when responses were ignored in responding to our community. So we're grateful and we're so happy that people are being responsive to this moment now. That's all I've got to say, and I just want to encourage everybody to encourage your friends to get vaccinated and take care of one another. Thank you.
Good morning, buenos dias, and bonjour. First, I want to thank Madam Mayor for the kind invitation and for all our stakeholders in this. Being together, we can be stronger. I am Dr. Lilian Abo. I am the Interim Chief Medical Officer for Miami-Dade County and a Professor of Infectious Diseases at the University of Miami. I really want to bring everyone and demystify a little bit what's happening with monkeypox and what can you do in your household to prevent monkeypox. This is really important. We transmit monkeypox through close contact. This is not just through sexual transmission, even though the majority of the patients that are presenting at this time have been through a sexually acquired route. We're seeing also close family members, household contacts that potentially can get infected. So my first ask to anyone who has monkeypox, please self-isolate. Don't go out and keep party and engaging in close contact with other people. You can be part of the solution in stopping the chain of transmission. So isolation until the lesions heal, it's important. Number two, if you have lesions or if you have been in contact with someone, get tested. Get tested, there are options for treatment, and now we have this vaccine. And the vaccine is available for two groups in particular, post-exposure prophylaxis and pre-exposure prophylaxis. What does that mean? If you're in a high-risk group, before you even get exposed to monkeypox, you can get the vaccine. You're hearing how you can make the appointments. There are very qualified centers that are opening as well, and the health department is working in expanding vaccine access. So this is phenomenal what the city of Miami Beach is doing. If some people have been in close contact with monkeypox, that's what we call the post-exposure prophylaxis, they can also get the vaccine right before they get lesions. So that also helps spread the disease to others in the community. As you all heard, Florida surpassed already 1,000 infections. Miami has over 400 infections right now. I'm sorry. And we really need to work together on stopping this. We don't want this to be another COVID. It doesn't need to be an endemic disease. We can stop the transmission. Another call I have to make is that this is not just an adult disease. We're seeing some cases in adolescents, and in other states, they have seen cases in pediatrics. So as our children go back to schools, I'm gonna ask all the teachers, let's do education. Our parents, talk to your kids, talk about sexual education. Make sure that kids are understanding how monkeypox gets transmitted. If your adolescents are engaged and sexually active, we need to talk about protection as well, but also close contact. Again, the vaccine is 2 doses, 4 weeks apart, and after 6 weeks, you're gonna have full immunity. I'm gonna pause, and if you have any other questions, I'll be happy to answer later. They told me that I'll answer questions in Spanish. They're asking me if I can say everything in Spanish.
I'm going to need that, Manny.
Yes?
Yes, go ahead.
Okay. Ok, buenos días a todos. Gracias a la alcaldesa Levine Cava y a todos los stakeholders, todas las personas que están involucradas en hacer posible la campaña de vacunación para los ciudadanos de Miami Beach. Yo soy la doctora Lilian Abo, soy la jefe interina del programa de Chief Interim Medical Officer de Miami-Dade County y profesora de infectología de la Universidad de Miami. Como todos saben, ya llevamos más de 1,000 casos de monkeypox en el estado de la Florida y ya van más de 400 casos en Miami. ¿Qué quiere decir esto? Que tenemos que actuar rápidamente y evitar que se siga regando la infección. La gente tiene que entender que hay varias formas de prevenir la infección. La vacunación es extremadamente importante y estas campañas de vacunación y la expansión del acceso a la vacuna es crítico para seguir previniendo que nuestra comunidad se siga infectando. La vacuna, como ya escucharon, son 2 dosis, 4 semanas aparte y después de 6 semanas las personas van a tener inmunidad. La vacuna es muy importante, es un factor que puede evitar que se sigan transmitiendo la infección y está disponible en casos de preexposición o postexposición. Por ejemplo, personas de riesgo, antes de infectarse, si usted está en los grupos de riesgo, para evitar el contagio deben vacunarse. O después de una exposición, lo que llamamos post-exposure prophylaxis. Lo que quiero mencionar es, nuestras escuelas están por abrir la semana que viene, nuestros hijos van a volver al colegio, los niños van a volver a las universidades. Es sumamente importante que la gente entienda que esta infección no es solo una cuestión de vacunación. Hay también contacto cercano, miembros cercanos en la familia que viven con personas infectadas se pueden infectar. Aislarse si están infectados es importante. Educación sexual y educación de cómo se transmite monkeypox es extremadamente importante en nuestras familias y en nuestras escuelas. Entonces le hago un llamado a la población, aquellos que tengan monkeypox, aíslense, por favor, no sigan contagiando a otros. Aquellos que no han tenido monkeypox y califican para la vacuna, vengan a vacunarse, consideren educarse sobre el tema. Y aquellos que tengan lesiones, háganse la prueba, hay acceso a tratamiento en la ciudad y en el condado, y aquí estamos para servirles y ayudarles. Cualquier pregunta que tengan, estoy dispuesta a responderla después. Muchas gracias.
Thank you very much.
Hi, and thank you again, Mayor, and the other mayor also, and all the commissioners and all the frontline caregivers. Martha Baker with SEIU 1991 at Jackson, representing the nurses, doctors, and healthcare professionals. But this is beyond just Jackson. We're the public hospital and proud to be the front lines, but all nurses and frontline caregivers in this county are thankful to you today for this reach out and the teamwork and the proactive way to take care of a healthcare challenge in our county is deeply appreciated. Generally, I would say in the past, we've had episodes when smallpox was talked about before, I don't know, decades ago, and it was Jackson dealing with it. So I think it's really impressive that this team of stakeholders behind us and beside us are working together to be proactive and make sure we get what our residents of Miami-Dade need and certainly the healthcare workers all over the county, specifically at Jackson, and all of the frontline police and fire and everyone is very proud that our leaders are stepping up and shoulder to shoulder with all of us on the healthcare front line to do the best we can. And while I would agree that's not a epidemic like we had with COVID, we've gotten much smarter and much better, and hopefully we will show our citizens and perhaps the country and the world how you react to another healthcare crisis in learning from our mistakes and our experiences. So thank you again, and I really appreciate from all the nurses and doctors at Jackson for being proactive and getting in front of this. Thank you.
Thank you so much, Martha. And now we're going to hear from Nomi. Nomi, what about Nomi? No. Okay, good. Great. All right. Now is your time. You have any questions for us?
You say that you're acting swiftly with this vaccine. Some people in the community are criticizing the county for acting after other community organizations have offered the vaccine. What's your reaction to that?
So the vaccine comes to the state for distribution through the Department of Health, and we work with our partners in the Department of Health. And we asked for the vaccine before we got it, and then when we got it, we immediately went public with the vaccines. We as soon as the vaccine we were communicating that we wanted the vaccine, and then we sent a formal letter last week. I think it was last week. So the distribution is the prerogative of the state, how they decide to distribute. And you may remember from COVID that we were constantly beseeching and begging for more vaccine here in this county based on our need. So we're hopeful that based on our numbers that we'll be able to be prioritized, and we're elevating it any chance we can get. Yeah. Right, so the vaccines are free, and they're being administered through our partnership with NOMI, which is also, you may recall, we're the only county in the state still offering testing and vaccines through the network at no cost to the county. I'm going to defer to Dr. Abo.
I think it's very hard to tell you because that's our population, so that would be a biased response. I can tell you we're seeing a predominance of male patients, but the demographic it represents our community.
It should be active. We were already receiving appointments. Okay, how do we want to answer? I'm not sure the answer. No? Okay, so Ron, if you could take that. Okay.
Okay, so as of early this morning, we did get overwhelmed in the early stage. So when everything opened up at 8 a.m., we saw over 100 calls come in almost instantaneously. So we did see some delays this morning. We're putting in additional agents to help handle those calls. We are continuing to train additional agents so we can expand those offerings. And really the goal is to ensure that anyone who calls and has a question or a concern will get that addressed as quickly as possible. The website, we've already had over 600 appointments made, so we do know it's working. The question is, I'm not sure exactly what issue he's referring to, but we haven't seen any issues with people being able to go all the way through.
Good.
Mayor, can you
Yes.
tell us if the declaration of a public health emergency by the White House last week will improve response, and exactly how, for Miami-Dade and for Florida as well?
So we're grateful to the White House for being proactive, and we are in communication with the White House on a regular basis about all sorts of things, and certainly will be at the forefront of any new initiatives coming from the White House.
Does it open up funding? Does it make it easier?
As of this time, we do not know exactly what it would mean. It's not a declaration of emergency. It's a public health emergency, a little bit different. And of course, we're standing by for any of the new funding or programs.
Quick follow-up. What if the state were to declare an emergency? How would that change things?
You know, monkeypox vaccines are being distributed at this current time without the formal declaration of emergency. We are still under a COVID emergency here in Miami-Dade County.
How quickly is monkeypox spreading in our county?
Dr. Abbo?
So if you look at our data, a week ago, we were under 200 cases. There was a big data dump over the weekend. So, you know, early, I would say over the weekend, we're around 300. Now we're over 400. So it is increasing. I would say it doesn't spread as quickly as COVID. As you know, this is a contact and droplet. It's not airborne like COVID. But it is increasing, as you can see. In a couple of weeks, it has doubled. So thank you for that question, because many of you are younger than me and some of you are my age or older. But if you all remember when HIV started, it started as a gay community disease and people were disregarding it. And unfortunately, in many communities, including the African American women, some of their partners were bisexual and started to transmit as to women. And when any infectious disease, when we start one group, it can spread to any other. So I don't want to stigmatize men who have sex with men or any other group. We are all potentially at risk. There is a group that is at a higher risk. And yes, men who have sex with men right now seem to be at the highest risk. And that's the targeted group for immunization, for getting the vaccines very quickly in that group, because there is rapid spread in what we call that social circles, right? So that is important. But I would avoid stigmatizing any particular group or gender. ¿En castellano o en español? Puedo hablar en castellano también. So in Spanish, what I was saying is that I don't want to create any stigma to any particular group. No, pero que en español no puedo, I'm going to talk in Venezuelan. So this is very important. No podemos, I started speaking English. Ay, perdón, qué pena. My brain is like, multitasking. Entonces, en español o castellano, lo que quiero decir es que no queremos que haya ningún estigma en ningún grupo en particular. Esta es una infección, como todos recuerdan, el HIV comenzó en un grupo particular, en hombres que tenían sexo con otros hombres y se fue regando a otras comunidades. No queremos que suceda lo mismo con el monkeypox, que la gente diga, esto es una enfermedad solamente de personas homosexuales o bisexuales. Tenemos que entender cómo se transmite la infección, es por contacto cercano, puede haber contacto sexual, droplets, besarse, abrazarse. Por lo tanto, miembros de la familia también que pueden estar a riesgo. Entonces, quiero que entiendan esto, que no es ningún grupo en particular, no es razón para entrar en pánico, pero todos tenemos que cuidarnos y los grupos de más alto riesgo, por favor, vacúnense, usen protección y eviten transmitir el contagio. Aíslense si están infectados, como dijimos anteriormente.
I have a question on testing. I just want to clarify. Will two county sites offer vaccines and testing, and both will be free of charge? Because right now, I think it's very difficult for some people to access tests.
So we are working through the mechanics of testing, since there are some limitations in terms of who can get tested. As we break through those, we are targeting starting testing at some point next week, but we'll provide more details through the mayor's office as that becomes available.
Could you explain, is the testing done by spit swab or saliva? Like, how is it
So currently available tests are completed by lesion swabs. We can also allow you to step in.
Yeah, so the only FDA-approved test is skin swab, and that's a challenge. Some patients are presenting with, I would call perianal lesions or genital pain, and we're unable to send that. We cannot, if you don't have visible lesions like saliva or blood, are not yet approved for testing. So we don't have any blood test or a saliva test. It's only if you have visible skin lesions, it's a swab. Many urgent care centers in the city are able to test, but definitely we need more access, as the health department has no way of testing. So that's an area where we appreciate all the support to expand testing.
So do you have to have a confirmed test in order to receive the vaccine or not?
No, wait a moment. The vaccine is not for people who have active infection. The vaccine does not treat or cure the infection. That's a wonderful question. I'm going to say it in Spanish after. The vaccine is to prevent. Prevention. It's like the COVID vaccine. Once you get COVID, the vaccine is not preventing, it's prevention, okay? Once you have the lesions, you may need confirmatory testing to receive treatment, but the treatment It's an emergency use authorization, requires, an IND through the FDA. You need a physician to prescribe it. The treatment is a challenge. Testing, you don't need a doctor to test you. It's easy. It's the treatment part that if you require treatment, it's more complicated. It's an oral medication, and it's called TPOXX. And not everybody meets criteria for TPOXX. 80% of the people self-limited, they get better. 20% of the people may need TPOXX, and they do need to see a healthcare provider in order to get the treatment. The vaccine, you don't need a prescription, but you can't have lesions. Do not come with monkeypox to the vaccine site, please. You're going to infect everybody. You can't come if you have monkeypox. This is to prevent monkeypox. En español, la vacuna no cura el monkeypox, la vacuna es para prevenir el monkeypox. Si usted tiene las lesiones y usted tiene monkeypox, no venga a vacunarse, va a infectar a todo el mundo. No podemos, se tiene que aislar o buscar tratamiento médico. El tratamiento es diferente. Para la vacuna no hace falta una prescripción, pueden venir a hacer su cita y vacunarse, pero no pueden tener lesiones activas. I will defer that question to the health department, who is in charge of doing the contact tracing. There have been several social activities, but I will defer that to the DOH.
Yeah, we don't have them here. They're not here. Self-identify. Do they self-identify? You want to? Yes. What age? So for those who are setting appointments for monkeypox vaccine, it's self-identifying, and that information is also on the website, or if you call, or if you go to the sites. And as far as the age for vaccines, I defer to.
It's 18. The new guidance allows it to go beneath 18.
Under 18
They're
as well.
changing to under
The new
18
guidance
for
is under
at-risk
18.
populations.
So the guidance is changing to below 18 for those at risk. So are we doing active contact tracing? Oh, no. So let's have Dr. Abo again explain what is the risky behavior. And if there's contact. Okay, so they say go to a movie theater, is that
You can go to a movie theater, you can send your kids to school, you can go on a cruise vacation, you can get on the public transportation. But again, my call is for people who have active lesions, do not go out in public, hugging, touching, close contact with others, and putting others at risk. Again, we have 400 cases in the community. Let's be rational. Let's take the proactive measures. We're here to talk today about vaccine and to stop the spread. But you can go on with your life. And if you are at risk, if you are in a population at risk, again, it's what I always say, it's sexual education. We don't, it's not just treatment, it's not just vaccination, it's social behaviors. It's what you do and how you do it.
Dr. Abo, some of us older individuals may have received the smallpox vaccination 50 years or more ago.
I wasn't born back then, so I don't know. Very good question. So
Repeat the question.
the question was, if I got the smallpox vaccine 50 years ago, am I still immune and I can go and party anywhere I want? And the answer is their immunity wanes off and you're not superhuman. Unfortunately, after 5 years, the CDC says you should get a booster again. So if you got smallpox vaccine 50 years ago, 30 years ago, you still need to get this vaccine again. One important factor, a lot of people ask me, what kind of vaccine is this? It's not an mRNA vaccine. It's a modified, what we called live virus. So it's safe. Most live virus, we don't give it to people with a weak immune system. In patients with HIV, it has been proven to be safe. So HIV is one of the groups at highest risk. People with other sexually transmitted diseases are groups at high risk. Laboratory personnel who may work with monkeypox or frontline EMS and providers may also be at risk. Like if you are an emergency responder who might need to be in touch with patients, you might be at risk and you may want to get the vaccine. There are side effects like with any vaccine, but so far what we have seen is safety. I have seen, some patients may have some fever, malaise, like with any other vaccine, but we have not seen severe reactions yet to the Jynneos, which is the vaccine that we have received from the health department.
Okay, very
All
good.
right, thank you.
Wait.
You did a good job. Don't go
If the
anywhere.
media wants to do individual interviews,
Yeah.
please don't move. We'll walk the line with the mayor and anybody else.
Good.